Welcome back. Pulmonary infections happen when a virus, bacteria, or fungus invade the lungs, causing inflammation. The CDC says these illnesses and respiratory viruses are making more children sick this fall. In today's Health Minute, Mandy Gaither has a look at the latest data and how to help slow the spread.
In parts of the U.S., RSV is on the rise, especially in young children. Cases of pertussis are 5 times higher than they were at this time last year, and now an alert from the U.S. Centers for Disease Control and Prevention about a surge in cases of walking pneumonia, particularly among preschool-aged children.
This wave began a little earlier and is much, much higher than what we expect from previous years.
Dr. Frank Esper with Cleveland Clinic Children says symptoms of this milder lung infection can last for weeks and may include a cough, low fever, and muscle aches.
It's typically caused by several different types of bacteria, but the most common one is called mycoplasma. And this is an old friend with pediatricians and adult physicians alike.
Esper says penicillin and amoxicillin, the antibiotics typically used to treat pneumonia, don't seem to work with walking pneumonia, so a different antibiotic regimen may be needed instead.
That antibiotic most commonly is azithromycin, also known as a Z-Pak by many people out in the community. And that actually does treat walking pneumonia very well.
Esper says those who are sick can help slow the spread of any illness by covering coughs and sneezes, by washing hands, and by staying home if you're sick.
Chicken soup yourself back up to good health and then go out afterwards.
Dr. Esper says there are diagnostic tests to determine whether a patient has walking pneumonia, but he says they're expensive and the patient typically has to foot the bill. So most of the time, those tests are saved for people who are really sick.